Today's guest is Ben Condon, a doctor turned clinical specialist at Heidi Health, a fast-growing Australian health tech company on a mission to modernize primary care through the power of AI. Ben combines frontline medical experience with a sharp eye for product innovation. And at Heidi, he's helping shape tools that actually work for clinicians, not just in theory, but in practice. We're going to talk about the kind of AI that doesn't just sound good in a pitch deck, but actually saves time, improves accuracy, and delivers measurable value to healthcare providers. So Ben, welcome to ROI from AI.
Thanks so much for having me. It's awesome to be here.
My pleasure. Now, you're a medical doctor by training. That's your background.
Yep.
What inspired your move from this clinical setting into the health tech and AI space?
Yeah, I worked for about 6.5 years, mainly in emergency, and I'd kind of observed that so many people didn't need to be in emergency. They'd be better served in the community, and kind of realized that innovation kind of needs to happen outside of the public system because it's just too busy delivering care. So that kind of started a journey into health tech, where there's opportunity to think differently and try and solve problems with technology in cool, creative ways.
Yeah, I love that. It seems like you had the experience, you saw the obstacle, and then you took it upon yourself to make that change.
Yeah, I think it was just a restlessness, really. Like the option really was to specialize or to jump into health tech, and I just kind of there was just something in me that wanted to make the jump. So, yeah, it's kind of wild now, a couple of years into that journey, to kind of reflect back on that moment, because it was a really big decision at the time, but I haven't looked back since. It's been a heap of fun.
Yeah, well, congratulations on the success. And Heidi Health is one of those companies that I feel like a lot of people have already interacted with. It's something that I've seen pop up when I've been seeing my GP. Can you give us a quick overview of what Heidi Health do and the problem you're trying to solve in primary care?
Yeah, of course. So, Heidi is on a mission to double the capacity of our healthcare system in the next 10 years, and we're using ambient AI to do that. And we're hoping that we're going to actually redefine how care is delivered and make care more meaningful and more human in the process. What that looks like in reality at the moment is we're an AI medical scribe. So, your doctor or your physio or your clinician, when you're seeing, will use Heidi in the background of your consultation to make a real-time transcript of that conversation. And from that, Heidi will make all of your clinical notes, any letters that you need, and kind of take care of that, a large part of that documentation, and really just allow your clinician to look at you rather than doing the keyboard arms and looking at, typing away as you talk, and just be more present, which we're really excited about. And in terms of the scale of this problem, doctors spend more than 40% of their day writing notes or doing some form of documentation. And with an aging population and a growing workforce shortage, if we can free up that huge chunk, like a couple of hours in their day, to just deliver more care, and also make the work a little bit more sustainable, we think that's like a really meaningful contribution to kind of helping us meet those challenges, both now and into the future.
Yeah, that's beautiful. Is Heidi actually listening? Is that how the technology works? It's hearing the consultation and making notes off that?
Essentially, so it's listening and make it. If you imagine like a court typist, it's making a real-time written transcript. So there's no audio recording, which can sometimes freak people out. So that's why it's an important distinction to make. But yeah, essentially, it's listening to the conversation, and it's able to understand. Like, I can talk to you in kind of normal lay terms, and it can translate that to clinical language and form a coherent note. So yeah, it's really cool.
Amazing. And does it make any decisions or ideas based on what's being transcribed, or is it literally just transcription?
Yeah, it's really important that we're not making any decisions or suggestions at this stage. We are a TGA level 1 device, so we're kind of registered and have gone through that process. But we make a very clear distinction that the job for Heidi really is to save time and synthesize the conversation into a structured template that the doctors set out. And then the doctor's job is then to review it and approve it, which takes seconds to a minute, rather than spend 10 minutes writing that note. So the time saving is not in the decision making, it's just in that efficiency gain, I guess.
Yeah. And I could imagine, obviously, productivity would increase a whole lot. You would have more human interactions, but I feel there'd probably be a benefit from burnout and helping doctors maintain their skill level, maintain their their presence because they're not having to rely on such menial tasks so often. Is that right?
Yeah, absolutely. I think one of the most powerful and consistent things we hear from our doctors and clinical users is kind of that sense of relief and that real return to vocation. Like, this is why I practice medicine. Like, it wasn't to do all of the grunt work to get the care, to navigate the system. It was to be present with patients and to, help solve really significant problems for them. I think, we hopefully can create space for that to happen at scale, wherever Heidi's used.
Yeah. And this is an industry where there's a lot of technology already existing, a lot of traditional technology in healthcare. What do you think has been missing in some of these attempts to digitize or automate parts of the healthcare system? How has it not happened sooner?
Yeah, I think that's a great question, and I think my hot take on this is a lot of hospital systems, electronic medical records are not actually designed for doctors. They're designed to meet a certain criteria or something, but they're very clunky. They're very siloed. You might be having 4 or 5 systems up in just to see one patient to kind of get an X-ray or get a blood result. And I think ultimately, to get efficiency and to get uptake, you need something that's designed for the people that are in it every day. And hopefully what we're building in Heidi is something that can, I guess, sit on top of that existing infrastructure. We're not trying to replace electronic records, but we can make it easier for people to interact with them in a much more efficient and much more enjoyable way.
Yeah, and I could imagine the data that you're gathering isn't always numbers. When you're dealing with people, you're dealing with emotions and feelings. So, what are your metrics for success in terms of measuring the ROI for Heidi?
Yeah, I think that's a great question. I mean, the metric that we look for in terms of our growth is the amount of consultations we're supporting a week. So we're supporting over 2 million consults every week right around the globe at the moment, which we're really proud of. And the more that number grows, the more time we save, the more kind of moments of care that we can impact, in a positive way. And I think ultimately the more clinicians we're helping kind of make the work more sustainable. Beyond that, with every clinic or hospital that we roll out with, we actually have a conversation with them about what are the problems you are trying to solve, because we can help you solve your staff overtime by getting staff home on time, or we could just make room for your staff to have that extra conversation or that longer consultation with your patient because they're no longer doing notes. So you can kind of ramp up the quality of the consultation rather than just the quantity or the throughput. And we can tailor that to kind of the clinic or the hospital setting. So those metrics, I guess, are flexible. But I guess our North Star is consult numbers and really trying to just grow that impact as much as we can.
And how have things gone with adoption? We're in this age where AI can feel very scary for people, and there's some reticence to adopting AI. How have you found in a clinical setting people are integrating AI? Has there been some roadblocks with adoption?
I think like doctors are pretty skeptical and risk averse by nature. It's kind of how we're bred. But it's been really interesting to see. I think that the need for some form of support has meant that hundreds of thousands of clinicians have chosen themselves to sign up and use Heidi, and then are kind of demanding their organizations to roll it out. So I think we're in a unique situation where I think the need is so great that we're able to kind of have that great product market fit. I think though a lot of the work that we're doing now is about actually educating clinicians about the right questions to be asking about AI, because I can tell you all of the things that make AI safe, but if I don't have a frame of reference to and a bit of a baseline understanding of like what AI is and what data security looks like in this world, I'm probably not going to be convinced by someone working at the AI company. So I guess like a big piece is on education of like what data security looks like more broadly, and then demonstrating how we've built like a really safe, compliant, secure product that is safe to use in these really important kind of, very, very private conversations.
With that, I'm wondering, is word of mouth a really powerful marketing tool to have more people adopt AI, or are you doing marketing sort of outside a clinic?
I think the secret to our success early days has absolutely been word of mouth. And I think there's something to be said for your colleague leaving on time whilst you've got hours of notes to catch up on, and then feeling happy. Like that's a very potent thing to kind of tap into. And yeah, I think word of mouth is huge. I think a referral from a colleague rather than a marketing campaign is always going to be infinitely more powerful. I think though what we're also trying, conscious of is we need to make sure that not just doctors but patients know who Heidi is, what we do, and why we exist. So there's always room for marketing and growth and all of those important parts that make a business. But yeah, nothing can really replace that word of mouth from a colleague in a busy clinic.
And doctors we trust, and time is currency. So I would feel like if my time was saved massively, then I'd be telling everyone that this is what I'm doing. I would love to know though, do you have a specific use case where you've seen a clinic adopt Heidi and how they've been able to benefit from a more specific standpoint?
Yeah, yeah. I've got an example from one of our GP networks in the UK, the Modality Partnership. So they rolled out Heidi it just as a 4-week pilot trial, and they had a 51% reduction in documentation time within their consultations with patients, and then a 61% reduction of documentation time outside of their sessions. So equated to, depending on the clinician, just under or just over 2 hours every day of time saved. Um, the thing that was most interesting is they didn't have one patient that said no to those consultations. Had 100% agreement and consent for Heidi use, and I think probably speaks to the fact that patients do trust doctors, and if doctors are comfortable and educated and understand what makes a tool safe, patients will trust us, which is a really special relationship that it doesn't exist in a lot of other industries. And the thing that stood out for me most is we surveyed those doctors, and 78% of them strongly agreed that Heidi helped them establish better rapport with their patients and had, um, you know, massive impacts in terms of their ability to connect with a patient. And then outside of that, on a personal note, as a clinician, the thing that made me really happy was, there was a 45% improvement in quality of work-life balance measures in that period. So it was, yeah, it's just like, I think it's tip of the iceberg stuff, a very small study that's now rolling out more, to hundreds of clinics. But I think that kind of speaks to the impact we can have in a very short space of time.
Yeah, that's the thing. It feels very new. Heidi has had so much success, but it's still kind of in those early stages. And you mentioned that you do want to perhaps innovate and take a little bit further. How do you see yourself balancing wanting to have innovative tech, but then also combining that with clinical safety and compliance? Because this is a field where there could be serious consequences if things go awry.
Yeah, I think it's a really good question. I think the thing that I guess we are really lucky is that we have clinicians at every part in every team of the business, and who understand the risks and the potential harm really deeply. Tom, our CEO, is a doctor, and it's really ingrained in the business to like handle what we're kind of meddling with, I guess, with care. But I think though we're really confident that a tool like Heidi can be built, with security and safety as a foundation, but really responsibly as well. Like there are guidelines that exist in every country, even though despite what you say in the media, some people say that they don't yet exist. But so there are guidelines, and then not you just have common sense, like in terms of where there is grey. The idea is to act responsibly and in a way that engenders trust from your clinicians using us, but also patients, because we're acutely aware that if we get this wrong, if we act nefariously, if we take a shortcut with something like this, like that's it. The music stops, kind of thing, and you only get one opportunity to build trust, and we certainly take that really really seriously. So I think it's just one of those core operating principles and culture pieces that um, you just have to have from the beginning, and we're really I'm really grateful to be working in a place that exists.
And things are moving very quickly, as you said, and it's good to have in the back of your mind the actual social impacts. I would assume there's a lot of companies out there that are just thinking about the dollars and cents and the business outcome, which is obviously important as well. But the fact that you're thinking about the humanity side of it, I think is really important. And these next few years, I think are going to be very pivotal when it comes to industries integrating with AI. So I'd love to know from someone like you that's actually working hands-on in the field, where do you see AI evolving over the next 5 to 10 years, particularly in the healthcare space?
Yeah, I think the opportunity for AI within healthcare really is to remove the friction of like clinician, like, or that a clinician has in their day that like doesn't need to be there, but is there just by virtue of necessity. And what I mean by that is like walking a paper request form down to radiology, three levels down in a hospital, to then like calling, chasing a report, and like then getting the report and having to take a photo and WhatsApp it to your consultant who's, potentially offsite. And then, all of that stuff like doesn't need to happen. Like we can just remove that from someone's day and just allow them to actually do the core thing that is their job, that is like caring for the patient, making clinical decisions. And I think by creating time and space for that interaction, we're going to see deeper care, and better relationships and better outcomes. And, beyond just the logistics within a hospital, I see AI, like we've just launched a calls feature where, Heidi can call and check in on a patient after a discharge or see how you're recovering from an illness. Now, the idea is if things are going wrong, your doctor is notified, and we're there to support, but also just like the visibility as a clinician to know that like you've sent someone home with a plan and it's going to plan, rather than, because you just never know really until you see that patient, weeks later in clinic or down the line. So I think that visibility and that like confidence that the care that you're giving and the plans that you're enacting are actually having good outcomes is really exciting, from just like elevating the care that everyone can expect, wherever you are in the world. And I think there's a lot of hype around white glove concierge medicine, that real kind of 5-star treatment. That kind of, I think AI will democratize that and will make it affordable and accessible for everyone, regardless of, the money you have in your bank account, to receive that level of care and support, which I think is super exciting.
Yeah. No, I love that. I love hearing it. I always think that AI will make us more human. That's one thing that I've learned hosting this podcast and speaking to thought leaders in the space, is that if AI takes away what's administrative and what's menial and what's rudimentary and allowing us to be more productive, then we have space to be more human.
For
That's what I'm
sure.
thinking.
Yeah,
But yeah, it seems like you
absolutely.
feel the
And
same. Yeah.
I think, yeah, no, 100% agree. And I think like we're not designed to like troll through pixels on a screen, and like computers can do that better than us, but what they can't do is the conversation. And I think particularly in medicine, half the art of the conversation is actually asking the right questions at the right time to get the answers you need to kind of put the pieces of the puzzle together. And I'm really confident that like there will always be a human in that chair, so to speak, asking those questions.
Yeah. Fantastic. No, I love that. But one question I do ask every single guest, this is a business podcast, so I would love to know, what is your biggest tip for a return on investment using AI?
Ooh. I think like in terms of like just a tip using AI generally in terms of the ways that you work, is that, yeah.
Yeah, like the biggest bang for your buck you can get by implementing some sort of AI into your business.
I mean, personally, it's sitting next to a prompt engineer and getting them to elevate the way that your prompts and the output that you can get. I think,
Mm.
um, yeah, I think again, it's probably the boring answer of like automating your work, your work day, your emails, that kind of grunt work, that the kind of hygiene that you need to do, and free up time and space for you to actually do the creative, deep thinking people stuff. That can be workflows with Zapier, that can be, all sorts of different integrations. But I think, yeah, the less time I'm finding spending myself in an inbox or trawling, through Slack, I think the more time you can actually do great work. And I think in time that, like, over a sprint, over a quarter, over a year, like, you will get so much more done just by having those extra hour or so in your day. Which is, I guess I'm kind of just repeating our value proposition now that I think about it, but it's
Yeah.
kind of true. It's just like in the basics of it all, set the foundation, and yeah, know when it's appropriate to use it, and when you need to actually dig in and do the work for you. Because I also don't think AI on like deep, complicated problems that require really thoughtful solutions. I'm yet to see any prompt that can kind of get you to a level that um, that doesn't need significant human intervention as well. So yeah, I think picking and choosing in that way is important as well.
And it seems like if you zoom out and see what is taking up the most time and what is causing the most obstacles, and then thinking, okay, here's a problem, I'm going to search for a solution and then just eliminate that time. It just requires a little bit of self-awareness over what is actually bogging you down the most. And that seems like that's been Heidi's whole genesis. Is the big problem was there was too much time being taken up with note taking. And it's so simple. And now it's grown into something so much larger. So you should be so proud of yourself. This is something that is really making such positive change. And it's been so nice to hear more about it. So thank you so much for joining me.
It's been a pleasure. Thanks so much for having me.